would it say value of assets here? Because it says the value of assets is 0, and yet you funded 1.2 million.
And I believe that's one of the rules, since it's not an irrevocable trust,
It can't be considered.
it doesn't
Right.
consider it a value of asset.
And
even
so if we
it's on
did
the
put it
city's
over there,
books.
then the
Yes.
7.7 would drop to 6.5.
Correct.
So
But that's still bigger than our equity.
Yes. But
And
as
who
I
knows
s-
what that's actually going to be?
And my understanding, Greg, is our total liabilities for retirement and for health benefits is close to 12 million. That means we're stuck with 12 million based on our previous.
And we're in good shape compared to most cities.
We're based on our previous Louise's calculation. If we went out of business today, we're still stuck with 12 million.
What is the answer, guys? What do you think? We just go on and we keep doing it from this 2 years ago forward? This number doesn't get bigger, is that the assumption?
Well, I think is the way it's set up for reporting purposes is that every 2 years, you look at the assumptions and you reassess what the, it's kind of the cost of this benefit that the city's providing to their employees. It's a retirement benefit.
Well, have you
Your own
funded the net
process.
OPEB at June 30th, $1.2 million? I mean, if you put it
Yes.
aside?
Yes, it's
Because it says
aside.
you've only paid $228,000.
Yeah,
That's sitting in a separate account. It hasn't, it's not in an irrevocable account.
But you treated it $878,000 as an expense in your income statement?
It did move over to that fund, yes.
So in the income statement, someplace
800,000.
there's a cost of $878,000 for healthcare?
It's in the internal, so I believe that's how it's reported, yeah, I have to double check, but there is $1.2 million liability sitting in the internal service fund with cash and investments matching against it.
And Greg, the way we change this, we can't change what's happened in the past. But the way we prevent ourselves from continuing to owe all these kind of monies for present employees is to change the rules and who pays for both health benefits and for retirement.
How many employees are there that are not working, or being funded, retired employees?
It might, if I could have that report back, it might list how many there currently are. And I think, so I think, you were asking, where do we go from here? I think setting up the trust is prudent.
Yes.
And I think as part of the annual budget process and labor negotiations, that's where the city looks at these types of benefits and determines what's appropriate.
But isn't it also important to find out what that, even though we're funding the current pay-as-you-go, what that $1.2 million balance has done over the years, so that would give us, actuarials are great, I'm sure it's all great. But how many years have we had that balance sitting there, even if it is in our general fund?
Just 2 years.
It's 2 years.
Yeah.
They started 2 years ago, and the
That's when the
$600,000
active
a year.
started.
Zero.
Yeah.
Well, so it was zero before that.
It was,
No,
Right.
we kept going.
Oh.
So they're funding $600,000 a year that's not paying for premiums. They're setting it aside in a reserve. So over 20 years, that number will get to $20 billion. But there's still not 7 million short, there's 6.5 million short
Today.
of the total liability today. But once they reduce the number of employees,
Which has already occurred.
what about the cost of the healthcare? When we say, if I'm a retired employee, do I send you the bill for healthcare, or do you just pay our premium and the insurance company takes care of it? Who takes care of the actual claims?
PERS usually pays the premium and we reimburse the employees. That's usually if.
No, I have a
somebody's
claim for
receiving-
$10,000 for an operation, I'm retired. Who do I send it to?
We're just paying the insurance premiums.
Just the premium.
So you send it to
one
the
of
insurance company pays.
Yeah.
The
Right.
requirement is
Right.
that they
They're
are
required.
retired from the city and they continue staying in the city's health insurance program. So we are just contributing towards the premiums, and then the health insurance will pay for whatever it covers, and we're just contributing to the
So we're just, the
premiums.
$228 is just a premium on the people who
Yeah.
are retired, not working.
Yes.
Right.
Now, the people that are working, where do we pay that? That's also in
That's
that
just
number?
We
paid
pay that
every
expense.
month.
That's
Every
our
month,
expense,
it's an
yeah.
expense for it.
But it's the same, it's a premium that goes to an insurance company?
Well, yeah, it goes to PERS, and PERS pays them, and then after that, it's not our concern any longer.
So it's both the active and the retired employees, that's the process.
Yeah,
The same
different
law, yeah.
relationships. And it's a little bit more complicated than that too, because there's some anomalies within the bargaining groups of the retirees, that, how premiums change, and if you'd said earlier that you wanted to, take meaningful conversations, we're gonna have some very complex meetings, I think, coming up on that, and not arguing with some of the lower level stuff. Because there's things we need to do about changing those anomalies as well.
Okay, so.
I don't have an answer to
Well,
your
what
question.
was it that we were gonna pay $1 million on, Jim, that we approved last meeting? And that it was, we were owed PERS over 5 years or something. What was that? Was that pension?
I believe that's on your finance committee meeting, are you also on the finance committee? On the finance committee meeting, you spoke about the PERS retirement money that is called a side fund.
Which is entirely separate from this, which is
Completely
another
different.
But that's
obligation.
pension payment, that's not.
That's pension,
Right.
correct. That's pension, retirement, and it was created when PERS restructured, and any agency that had less than 100 employees, I believe, was put into a statewide pool. And so then, since everybody was in this pool and paying the same rates going forward, they did a true-up calculation for every agency, and that's what is called a side fund. And so the city does have a side fund obligation for safety and non-safety that's over like 5 to 9 years. And so that's another item that we're analyzing on whether it's a benefit for the city to pay down that side fund. And
Did we pay it?
we have not paid it.
Because we're really at risk with the whole pool there. If everybody else gets a number of employees, then
Well, I
our
think
percentage is gonna be higher.
we're gonna do an analysis of what that would do to our rates and how, when we're doing the budget, we're going to analyze what a pay down of the side fund would gain us. Would sending our cash,
Well, the theory was we were gonna save us 7.75%, but I never believed that, so that's why I'm still.
so we're gonna get a report from PERS and do an internal analysis.
And that has to be compared against what the rate reduction would be. So
Okay,
it's
well,
gonna be
sounds like-
fairly
That's not on the
complicated.
agenda, but that's on Thursday's
You're on top
agenda.
of this, is the way I would say it.
That's on Thursday's agenda.
You're on top of it.
So I know this isn't on the agenda either, but do you mind if I ask a question? So the question that I have, not of you, the question that I have is, are there, did you call it a sidecar or a side fund? Are there a bunch of these that are out there, this retiree, okay, so we're talking, there's two, so there isn't like $20 million of fungible whatever sitting out there?
One-time thing when they made the transition to the new
Yeah.
pension fund.
Okay, but meaning that the unfunded retirement benefits and then da-da, there's all these little pockets out there that we don't have all those. But that's the thing that, I mean, if we're looking for some meaningful things to work on, it sounds like that.
Oh,
might be-
absolutely,
Yeah.
absolutely.
Yeah.
Plus, you can see that it's very difficult for the public or the media to understand this stuff.
Oh, well, well, that's what I think is probably a really important thing is for us to, that sounds like you're already doing it, get your arms around it before it does go viral in public and all of a sudden we got, mass, everybody running for the gates.
I think our goal is also to look at the whole city, the city as a whole, not just focus on one issue and look at that only. You really have to look at the whole city, the entire city budget, what the needs are of the city and the goals, before we just make decisions on one item at a time.
And we don't have 28 employees now, is that right?
I think it's about 28 employees total,
What did we have a year ago?
about twice that much, 50.
So that so what about the pension liability on those people?
Well, those are all some of the things we need to take a look at. What's changed, what's different? There was some retirees out of that. So some folks chose not to receive payment, but they opted to actually retire. So we have to take a look at all those things, put them all together
That
and
would
make
be
a
a
business
substantial
decision.
change, I would think.
Well, that's sort
But
of
there's
the,
also, some of these people are still collecting unemployment benefits. They didn't retire, basically.
Well, they weren't old enough to
They
retire.
They weren't.
Right.
well,
So
some,
if they go back to another public agency, then the public agency will be responsible for them.
We will explain.
I want to find them a job.
All right, are we ready for
Yeah,
our
we-
next
Well,
meeting day?
okay, Okay, no, so let's close this off, item 5. We've discussed it. Are we making any motion? I'm kind of lost in this conversation. It sounds like more work is going to be done.
Report.
And a report's going to be made, and we,
If it's okay with you all, I think we'd like to bring it back to you as soon as possible. If it's next month, then, or whenever it is you set the meeting date, I don't want to also burn out Deborah, because this is one of 50 things that she's working on.
right.
But we'd like to get back
We
to.
decided that should be on the agenda for whatever.
Absolutely, if that's okay with you all.
You can decide.
Okay, so we would like an update. Let's
Sure.
leave that kind of open to when you're ready for it. There's no need to bring coming back with useless information.
You need to make
I'd
decisions
like-
before the
Right.
budget,
Yes.
Right.
I'd like to bring it
Oh,
back
yeah.
to you after I have a new actuarial study. Then we'll have something to talk about.
On both payroll, or both on pensions and healthcare, or just healthcare?
Just the healthcare portion, the one's on the agenda here, the OPEB obligation.
Okay.
So I believe we can do that in a couple of months. I don't know how
Okay,
often.
so who is developing this agenda now? Will you be Deborah,
I would-
That's a great
I would be working with the city manager to develop it
Okay.
based on the comments that come from the.
So
community.
based on your good judgment and your schedule, why don't you decide what meeting it's placed on? Don't put it necessarily on the next one if you're not ready.
Yeah, if we don't have the results of the actuarial study, I'll carry it to
Right.
the following.
And we have enough on the next couple
It's
of.
interesting, I saw something on TV, but I haven't had a chance to go back and look at it, about how healthcare costs are going down. I don't know why. I know there was a segment on the Larry News Hour that I say to try and catch up, but
because of Obama.
Well, you know what, based on my
That's
recent
interesting,
healthcare
because here's
bills,
the
I-
trends.
I sure as hell don't think they're going down.
Or mine.
Okay, let's have somebody make a motion that we will get an update on this item 5, irrevocable
Jim, you
trust
He's made a motion,
sometime in the
second.
near
I'll
future.
second.
Okay, second, good. Okay, next meeting date, agenda time, in another couple of months, 2 months?
Well, can we talk agenda, so to give this thing some meaning, we serve at your leisure here as the council members. What do you really want us doing, rather than,
Well,
coming back
really,
and forth and going?
In a way, it's up to the new members, the new council members, Bill and Elizabeth Lewis,
Okay,
to decide on that, because I won't be here and Jerry won't be here, or it's unlikely.
okay, so let's wait.
Yeah,
People
let's
are telling me that why,
Yes.
well, I know we gotta get the purchasing policies.
Right, we've got at least 2 items
Yeah,
for the
before we get
next
that.
meeting.
We'll get that done.
Your letter.
And they want the OPED, so I know they want those
And the
two, the
purchasing
OPED
policy.
and the purchasing policy.
And then possibly sometime in the near future, the irrevocable trust. So let's just leave it at that. I think there's
Right.
plenty to talk
Right.
about. And then we'll talk to Elizabeth and Bill when they get back.
okay.
Tuesday.
And
Well,
they
we
can
want
set-
to wait then and we should wait, rather than us set the agenda for the next meeting, have them,
Well, we have the agenda, we just don't have the
I mean,
date.
that date.
Well, I think we should put those two items back on, the purchasing policy and
We
the
are.
OPED.
Yeah, but the
Yeah,
date,
no, well, the open is when
With those two.
Deborah's ready.
we're setting it.
And right now, we're definitely putting on the purchasing policy and then the Mayor Dobby's letter to the county of San Mateo issue.
Well, do we meet,
Council member Dobby.
Oh, we've been demoted. Okay.
do we meet normally on a certain date? I don't know.
We've been, it's been sporadic. I think it's been a Tuesday at 2-ish because Bill preferred that afternoon. And I'm okay with afternoons. I think that I would propose maybe in about 2 months.
I mean, Bill generally, from my experience in the past, likes it in the afternoon.
Right.
Yeah, I think so.
But let's set
Was
a,
there any urgency in either one of these items that we need to do
I
something?
mean, theoretically, I think the audit committee meets 4 times a year. Isn't that
Yeah.
quarterly? So this is,
So why don't
we've
we
been
meet
meeting a
then?
lot.
So then why don't we just meet in April? Figure out April, and that gives you time to do what you need to do, we're not breathing down your neck, and then,
And then maybe
But
we'll
unless
have
there's
that
something else we
that
need.
third agenda item.
Oh, yeah, I think we should.
So then we'll have to possibly 3. Okay, let's do it April. Who's got a calendar?
The 10th or the 17th are the 2 Tuesdays in the middle of April.
What's the council meeting?
Council is on the 18th. Oh, and the next council meeting, I can tell you, just hold on a minute.
April 18th is a council meeting, so that either the
Oh,
10th or the
April
17th of April, if you
Let's
want to
go
keep it on
10th.
Tuesday.
10th at 2? Anybody have any conflicts yet?
April 10th?
I
Yeah.
have
I won't be
vacation on
here.
there.
Oh, you're on vacation? Okay, then we can't do without you, so when
I
are
won't
you
be at
back?
council meeting, I won't be at the audit meeting.
What's your
I
vacation?
know, you've been here 10 years yet?
April, well, I was gonna take that week off because my kids are out.
Why don't we do it on the
Daycare.
17th?
Okay, April
Time Saturday,
17th.
Jack, for the audit
Is
meeting.
that's not Easter.
What day?
April 17th, the day of the week is?
Tuesday.
Tuesday,
Yeah.
at 2 o'clock. Okay, that sounds good. Okay, with that in mind,
vote.
let me, second, all in favor?
Aye.
All opposed? Okay, meeting adjourned.